I'm Dr. Jefferson, and I'm excited to discuss the popular topic of antibiotic use during this segment of Ask the Pediatrician. The majority of illnesses that cause your typical cold-like symptoms, such as cough, sore throat, and congestion, can be attributed to either viruses or bacteria. As your children's doctor, we utilize the history that you provide regarding your child's illness, as well as physical exam findings, in order to help us best decide how to treat your child. There are over 200 strains of viruses that can cause these cold-like symptoms. Unfortunately, antibiotics, which are effective at killing bacteria, have no effect on viruses. Thankfully, our bodies are efficient at clearing these viruses and only require us to provide supportive care. It is important to note that although our bodies are effective at clearing these infections, it can take up to 7 to 10 days before the symptoms have fully resolved and your child is acting more like themselves. Bacterial infections, on the other hand, do require the use of antibiotics in order to adequately clear the infection. Because both bacterial and viral infections present similarly, you will often hear us advise to provide supportive care for the first few days of illness. However, if your child is having difficulty breathing, complaining of pain, or you just feel uncomfortable, we want to evaluate your child promptly. However, if your child is stable, waiting 2 to 3 days providing supportive care gives your body time to fight the infection and helps us to better determine if a bacterial component may be present. We strive to provide the best care for your child, and inappropriately prescribing antibiotics for a presumed viral infection will not help your child feel better quicker and may also cause some unwanted side effects such as diarrhea. Globally, as your healthcare providers, we're striving to use antibiotics responsibly in order to help decrease the rise of antibiotic-resistant bacteria. We know that when your child is sick, you just want them to feel better as soon as possible. We are here to provide the best care for your children and want to do everything within our power to help them feel better. Just remember that sometimes antibiotics aren't the answer and that fluids and snuggles may be the best medicine. Thank you again for trusting us to take care of your children and being a part of the Carithers family.